Hi, we are going to be talking today about survivorship. And this is something that is definitely so important to me, Fran. I know that you have seen
Mhm.
that a lot with patients and
Yep.
their families. So we kind of want to discuss that a little bit more to see, what happens after diagnosis, after surgery, after chemo and radiation. What happens? And personally, for me, I noticed that once I was done with treatment, because you're on a schedule, you know what's happening. So you're always prepared and saying, I have to go in and have this chemo. I have to go in and I have this doctor's appointment. And then it's over and they say you're okay and it's done. And then it's almost like I literally had tears in my eyes. I actually had that release. And I almost feel like it was a fight or flight type thing. And I didn't know what to do with it. And so a few things that I kind of noticed for myself was to talk about it, to seek out help, to speak to people that you trust, to just discuss those feelings in order to be able to move forward. Because no matter what, at the end of the day, in the back of your head, it's almost like your body failed you, but you're healed. And I feel it's such an important thing, because I feel that we all focus on treatment, we focus on the doctor's appointments, we really kind of talk about all of those things, but we don't talk about what happens after everything's done. And my question for you is really, what do you see with your patients and their families of after when treatment's over, what happens?
Well, thank you for sharing. And my name's Frances. I'm a social worker at NYOH Oncology, Hematology. And so I work with patients before they get treatment, during treatment, and then after treatment. And I would say the biggest thing I notice when patients complete treatment, you talked about this a little bit, is that we sort of put expectations on ourselves that I should feel a certain way.
Mm-hmm.
I should feel happy, I should feel excited,
Yeah.
or I shouldn't feel upset, I shouldn't miss my team, or kind of put a lot of expectations on themselves.
Yeah.
And so one of the most important things I think to think about when you're entering survivorship is that everything that you're feeling is normal. There's no one way to feel. And most likely you're going to feel a variety of emotions. You may have experienced day by day, minute by minute, as you sort of move away from treatment, and have a lot of surprising feelings. I never thought I would miss my treatment team. I never thought I would miss walking into my cancer center. Well, somebody else would say, I can't, I'm so glad I'm not there anymore. So again, there's no one experience that is right. No one experience is wrong. It's really paying attention to what's going on for you. And as you mentioned, talking about it and what looks right for you. That can be talking to family and friends. That can be talking to a social worker. That can be talking to a therapist, connecting with a support group. But I think really recognizing that sometimes it feels like now that treatment's over, maybe I don't need any more support. And sometimes that's when you might need the most support, or a different kind of support.
Yeah. And I think going along those lines is thinking about giving yourself grace. It's almost like, as a mother, and having a full-time job, nothing stops. When you're done with treatment, yes, treatment's over. That's wonderful news. Everything is good, but reality is still there. So it's almost a difficult thing of just kind of being able to go right back to work and act like your normal self when nothing's normal anymore. And I think my question to you is, what type of advice do you give to people that are going back to work, that are parents, that are, kind of dealing with that feeling? What type of things do you tell them, when they're going back to work and going back to reality per se?
Yeah, and I think that's a great question. I think first thing is to really recognize that sometimes it's only when treatment stops that you're really able to sort of emotionally catch up to what has happened. Because often when you're in treatment, you're sort of just doing what the doctors tell you, treatment, blood tests, you're sort of go, go, go. And that makes sense. That's what you kind of got to do. And sometimes when your schedule slows down, maybe you're physically feeling better, you're not coming to clinic so much, that's when you start to emotionally catch up. So I think sort of what you said, giving yourself a little bit of grace. Okay, maybe I'm physically feeling a little bit better, but now sort of emotionally some things are coming up and I need to pay attention to them. And so I think recognizing that when you enter survivorship, it may not be that you still don't need help. It may just mean you need different kinds of help. So if you weren't working and you want to return to work, it may still look different than before treatment. if you're parenting, it may be, you know, I felt like, okay, once treatment's over, I don't need any help with my kids. Maybe that just looks different now. Maybe I don't need as much support, but I still need support. So it's really kind of paying attention to what you need, because you may still have needs. It's just they've changed. And so giving yourself that time and space to kind of figure that out. And that's where we kind of circle back to talking to somebody, whether it's family and friends or professional, to kind of tease out, what do I need now from myself? What do I need from my family and friends, from my workplace? What boundaries do I need to draw? And so continuing to have the conversations with yourself and others about kind of what you need to take care of yourself.
That's great. That's great advice. And I will say, in terms of that also, is the one thing that I can take from it is to not only give yourself grace, but for me personally, what really helped for me was sharing my story, sharing the ups and the downs and the everything in between, and talking about it. And I think that's probably the one thing I can advise everybody to do, is if you're comfortable with that, you know, talk to that person you trust, share that story, get it out, you know, to be able to move forward, because you're still here, you know, and it's, I think that's one of the most important things that I can take from it. What do you think? Any final thoughts, you know, from you that you can actually share, you know, for our patients and anybody that's listening right now?
Yeah, I think the two things would be to give yourself permission to feel however you're feeling, to try to move away from putting expectations on yourself that I must feel this or I must feel that, and connected to that, to not be afraid to ask for help. Even if, you know, maybe you didn't have a lot of professional support during treatment, maybe now is the time. Maybe you didn't lean on family and friends as much then, but you need that now. And so it's never too late to ask for help, and it's never too late to explore different types of support.